Hi and welcome to this antenatal pelvic health education. So just to introduce you to our team, we are your perinatal pelvic health physiotherapy team and service. So there's myself, Debbie Seary, the pelvic health physiotherapy assistant, Erica Teagan, our pelvic health physiotherapist, and Julie Pilkington, our specialist midwife. So firstly, congratulations on your pregnancy. So you might have already noticed that there are some changes that take place in your body and your pelvic health during this time. So most of our systems will undergo some changes, from your cardiovascular system to your respiratory system, digestive and hormonal system. For example, you might get a little bit more breathless when you're moving about and you're exercising. You might experience some dizziness, and you might notice some changes also to your bladder and your bowel functions. Your posture will also change as your pregnancy progresses, and this is just to accommodate your growing baby, but it can sometimes cause some general aches and pains. So what is common during pregnancy? So what we typically describe as being common is some small bladder leakage with coughing, sneezing, vomiting, where you leak a little bit of urine when you do those actions. You might also have increased frequency of urination. You might feel a little bit heavier in the pelvis or a feeling of fullness in the vagina, which is the weight of baby. You might get some poorer sleep and some hip, lower back and pelvic discomfort. What's less common is more frequent leakage that's maybe impacting your day. Some uncontrollable urge, pelvic girdle pain, so any pain around the pelvis, around those joints, any heaviness or dragging or bulging sensation in the genital region, and also any poor control of wind or bowels. But there's lots that we can do to look after our pelvic health in pregnancy. So our next few slides are going to focus on what we can do. So some self-management might include pelvic floor exercises, otherwise known as Kegels. You might also want to download the NHS Squeezy app for more guidance. And just generally staying active, doing what you normally would do with exercise and just modify as needed to. And that is just so that you maintain strength, but also we get a nice mix of strength and mobility too. We want to look at managing pressure a little bit more too, especially as your pregnancy progresses and there's more weight generally down on that pelvis and pelvic floor. So we're going to look at these on a different slide. And you might also benefit from some pelvic floor relaxation, managing stress, and this might include breath work, pelvic stretches, anything like yoga, Pilates, or any mindful activities that you enjoy that help you manage your stress better. So your pelvic floor muscles are a group of muscles that have three main functions. They help to maintain continence of urine and stools. They help support the pelvic organs, which are your bowel, your uterus, and your bladder. And they're also an integral part of your inner core stability system. And these muscles need to be able to contract and relax automatically when needed, but we can also consciously contract and relax these muscles to help them do their job better. So some of you might already be doing your pelvic floor exercises, which is great. And we do recommend that everybody does our pelvic floor exercises regularly, particularly in pregnancy and that postnatal period. And it's really important as well that we start to use the breath with our pelvic floor exercises also. So if you're sitting comfortably or you're lying down, you could try this with me. So we're going to take a breath in and allow your tummy to soften and expand along with the sides and the back of your rib cage as you take that breath in. So imagine inflating a balloon as you inhale. And then as you exhale, imagine closing up through the back and the front passage. So imagine stopping the flow of wind and also urine. And then lift internally, almost like imagining the seat is hot and we lift that perineum away from the seat. We're going to hold this lift and work towards holding up to 10 seconds without holding the breath. And then when you're ready, we're going to slowly relax and then just take a breath or two in between to fully relax before we continue. So we make sure that we're not squeezing the buttocks, we're not holding the breath, and also just watch that you're not breathing high into the chest, so that we are breathing well into the belly and the ribs. Okay, so tips to manage pressure. So we're, like we've just done, and we've already explained, we're trying to breathe using the belly as well as expanding into the ribs so that we're not getting all that pressure down onto the pelvic floor. And then we're also using techniques called the knack. And this is where we engage those pelvic floor muscles on your exhale on any effort. So it might be from going from sit to stand, it might be lifting or pulling or pushing anything relatively heavy. So that might include carrying shopping bags or lifting shopping bags, lifting the small child or your baby when they do arrive. And you can also do this lift of the pelvic floor before you cough and before you sneeze. And it might just prevent those little leaks as well. We also want to think about our posture when we're sitting or when we're standing as well. So try to avoid slouching. Use your cushions instead to get that support that you need. And then lastly, we want to try and avoid constipation. So we should be able to empty our bladder and bowels with ease. So the bowels love fibre, fluids and movement. So look at your diet first, look at your fluid intake if you are struggling. And then you might want to consider some over-the-counter medication if needed, and maybe the use of the squatty potty, which you can see in the picture, which you can easily replicate with a couple of toddler steps or a little stool of some sort. And this just raises the knees above the hips and allows the pelvic floor muscles to relax a little bit more. And then we just lean forwards. And this is to avoid any kind of bearing down on the pelvic floor, which can ultimately weaken your pelvic floor muscles. Importance of looking after you. So looking after your whole health. So thinking about your mental health, what tools do you have to look after your mental health throughout pregnancy and beyond? Your physical health, so this might include nutrition, fluids, as well as your exercise. And then emotional health as well, looking after what's on your plate, making sure that you're not taking on too much, and that motherhood mental load as well, which is sometimes something we refer to when maybe the mother or as a parent, you're taking on maybe a little bit more of the load than perhaps the other parent in your team. Stress levels can affect your pelvic floor function, which is why it's important to manage your stress. And filling your cup, of course, allows you to be the best version of you as an individual, as a parent and a partner.
So moving on to think about exercise in pregnancy. It is perfectly safe and encouraged to exercise during your pregnancy. If you're already exercising, keep it up, keep doing what you're doing for as long as that feels good for you. As you progress through your pregnancy, you might feel the need to adjust the intensity of exercise, whether that's lowering the weights you're doing or just avoiding certain exercises you might find uncomfortable or that cause you any uncomfortable breathlessness. Even if you've not been active before your pregnancy, building strength and endurance is shown to benefit mother and baby and promote a positive postnatal recovery. Starting slowly, for example, taking short walks and building up gradually. There's lots of prenatal safe yoga classes and Pilates classes that are a very safe space to join before your baby comes and build up some strength. Consider what your barriers are to exercise. Is there anything stopping you? Are there any things you could change to make room for that in your life? There's lots of resources online for those of us that can't get outside, and there's loads and loads of tools we can find to get engaged with exercise. There's evidence to suggest that exercise of moderate or even high intensity has a positive outcome on fetal development, with lower instances of high or low birth weights and reduced risks of premature labour. Here's an infographic on how you might think about approaching exercise in your pregnancy. I would encourage you to screenshot and zoom in on this infographic. It gives some ideas and some advice on how you can progress or change exercises to suit you and your body as you go through your pregnancy. You can see it recommends to do muscle strengthening activities twice a week. Aim for at least 150 minutes of moderate intensity activity every week. So moderate intensity means getting your heart rate up a little bit, not to a point where we're completely out of breath and can't do anything, but getting that heart rate up, getting ourselves moving nicely and comfortably. It's important to build your resilience. So creating bespoke self-care habits, tools for relaxation, time that's just for you. Relaxation looks different for everyone. Maybe for you, it's meditation, breath work, or it could be exercise, just catching up with some friends, spending some time doing your hobbies that you're interested in, or classes, or just preparing for your birth, taking time to think about things, doing some hypnobirthing and making some plans. Ensuring you have a circle of support, so friends, family, people around you that can help and support in roles that you may not feel comfortable or have the energy to take on during your pregnancy. Redistributing roles, delegating jobs, batch cooking, and preparing for the fourth trimester. Mental and emotional health support is available. There's NHS mental services. On the Wirral, we've got Talking Together, Pandas, and the Children's Centres. The Children's Centres are a great resource for pre- and postnatal family support. Reach out to your midwife, your pelvic health physio, your health visitor, or your GP to signpost you and refer in. Signs you may benefit from some extra support may include persistent low mood, difficulty controlling intrusive thoughts, anxiety that is impacting on your daily life, thoughts of harming yourself or your baby, persistent negative thoughts or memories surrounding your birth experience, and difficulty bonding with your baby. If you feel you're struggling to manage your mental health, please reach out to someone. There is support available. Fueling your pregnancy is incredibly important. We're growing another person, sometimes 2, 3, even more at times. We need to really make sure that we're putting enough in the tank, that we have enough for ourselves to get through our day. So eating plenty of fruits and vegetables, aiming for that rainbow plate. You want lots of variety and lots of colours on your plate. Trying to include protein with every meal and snack. Examples of this can be meat, fish, eggs, nuts are another great one. Things like peas, beans, and lentils, dairy products. Greek yogurt especially has loads of protein in it and is a really nice snack. Staying hydrated. So the aim is for 2 litres of liquids a day. Your preferred is water, but if you're drinking other things, try to reduce caffeine and try and avoid sugary and carbonated drinks. So looking at when you might need to seek support and advice for your pelvic health, could be pelvic girdle pain that's worsening or affecting you daily and is not resolved by 12 weeks postnatal. So what's meant by that is if in your pregnancy you're struggling to get about your day, maybe you're needing to take time off work or adjust the things you're normally doing, you might need to reach out to your midwife to refer you to our service. Or if you've had some pelvic girdle pain, whether or not you've seen us in your pregnancy, and it's just stuck around, it's a bit stubborn, it's not going away, then you might want to get referred in to be seen by us. If you're not making it to the toilet on time, if you're finding you're leaking with movement, with jumping, anything like that, or leaking significant volumes of urine, it might be time to reach out to us. Feeling any bulge or heaviness in the pelvis or pain in the joints, genitalia, or pain with sex. So it may be that you have symptoms you think might correlate with a prolapse, or you may have had a birth injury and be experiencing some pain regarding that. And again, abdominal separation, you might have heard of diastasis or DRAM at 16 weeks plus postnatal. So the reason we say 16 weeks is that it's normal for your rectus abdominis, that's your abdominal muscle, the six-pack muscle. It is normal for that to stretch during pregnancy, but it should tend to reduce and draw back together in that postnatal period. If you're finding that it's not drawn back together and you're having bothersome symptoms, maybe you notice some like strange feeling when your stomach is pressed, or you notice what they call doming, you might want to reach out with us for some support with recovery from that. Referrals for the service come from your GP, your midwife, or your health visitor. Important things to look at and when you should seek urgent support and advice. So with these particular symptoms, they tend to correlate with back pain, and we would be recommending anyone with back pain, pregnant or otherwise, to go to A&E with these symptoms. So that's a loss of the bladder filling sensation or a loss of urge. So when you don't know that your bladder's full, you're not getting any clues that you need to empty, even if you've been drinking your normal amount of water, or if you've lost any sensation to go. So full loss of the bladder or bowel contents, where we're just not knowing that we're emptying at all and suddenly we've lost our full bladder. A change or loss of sensation in the genital region. So maybe it feels numb in your genitals, or you feel constant pins and needles, or you go to wipe and you can feel it from your hand, but not necessarily from the other side. Any loss or change of sensation or pain that's constant in both legs at the same time, and any pain that is constant, preventing you from sleeping at night, where you're unable to get back to sleep. So sometimes we have discomfort and pain that might wake us in the night, but we're able to reposition and get comfortably back to sleep. If you're not getting to sleep at all, if that pain is keeping you awake all hours, it's time to get that looked at and take yourself to A&E.
So now we're going to look at the birth itself. So the three main delivery methods are vaginal delivery, assisted delivery, which includes forceps, ventouse, and episiotomy, which is a small cut to the perineum, and a C-section, which could either be planned or an emergency C-section. And there are three stages of the vaginal delivery. The first is your active birth stage, which is when your cervix dilates. And this is when we want to be doing some movement, lots of rest, and just helping the labour progress. Stage 2 is the actual delivery of the baby. So at this stage, you might want to already have a think about what positions are going to be most helpful in terms of helping you deliver, where you're going to feel more comfortable, and allowing for that pelvic space for baby to deliver. And then stage 3 is the delivery of the placenta. And now we look at the delivery tools that you can utilise. So you might want to think about creating your calm birthing environment. So we want to be as relaxed as possible to allow oxytocin to flow in order to help your labour progress. So think about some music that helps keep you calm, maybe use of battery operated candles or some sort of lighting, pillows that you might want to bring from home, a diffuser, the use of massage, and maybe even a birthing ball as well. And then breathing techniques that can help keep you calm during your birth. And one of those is called the de-stressor breath. And this involves just taking a normal breath in and then a really slow exhale. And this is something that you can practice before birth as well, so that you have that tool available to you when needed. We want to try and avoid breath holding at all where possible, or what we call purple pushing, which is when we breath hold, just because this puts a lot of pressure on the pelvic floor. So ideally, a maximum of 3 hours of pushing for your first delivery is the guidance, or 2 hours for subsequent vaginal deliveries. And then it's also a good idea to have a bit of a birth plan, especially if you're someone who likes to have a plan. But we would suggest that you be as flexible as possible. So having that plan A, B, and C, and thinking about each stage of that labour, what might happen and what options are available to you, and what would you prefer if asked at that point, what you would prefer. And just making sure that whoever is in the room with you, your birth partner, understands your preferences as well, because they are the best person to be able to advocate for you so that you can stay in your calm zone and birth your baby. So thinking about your birth positions, which I mentioned before, so this might include kind of a kneeling position on the bed, maybe an all fours position, but this is something that you can read up about and look into as well. And also you might find that you just follow your body's lead and adopt a position that feels right at the time for you.
It's important to note that there's a risk of birth injuries and perineal tears when we have vaginal deliveries. The most common is a first-degree tear, which can often be called a graze. It's usually just a superficial wound. It may or may not be stitched into the delivery suite, and it usually recovers itself quite nicely. A second-degree tear is a tear to the perineum. That's the area separating your vagina and your anus, is usually again stitched in the delivery room. Occasionally, someone might have a deep second-degree tear, and that might require stitching in theatre. A third-degree or a fourth-degree tear are very uncommon. These are tears that extend into the anal sphincter. So a 3A or a 3B tear extends into the external anal sphincter. A 3C tear will extend into the internal anal sphincter, and a fourth degree tear will tear right the way through into the mucosal lining of the anus. What that means is we're extending through that external sphincter, which is contractile muscle. It's muscle we have control over. If we get tears into the internal sphincter, that's smooth muscle, like muscle in our guts, that just passes through reflexively from our body. And then into the mucosal lining is when we have that opening between our rectum and our vagina. These are typically stitched in theatre, and they're known as obstetric anal sphincter injuries, or OASI. An OASI occurs in approximately 3% of all births. With your first vaginal birth, you have about a 6% chance of sustaining an OASI. Your risk drops to about 2 to 3% in subsequent births if you've not had an OASI. But if you have, it stays about the same. It stays around that 6%. If you sustain an OASI, your aftercare should include a follow-up with gynecology and an automatic referral to us, the PPHS service. There are some things you can do and your midwifery team can do to help reduce your risk of tears. Avoiding prolonged pushing. So as we said previously, no more than 3 hours for that first vaginal delivery and 2 hours for subsequent births. Modifiable lifestyle factors like staying within a healthy BMI range can lower the risk of a larger baby and lower the risk of developing diabetes. And smoking cessation. So things like diabetes and smoking all have impacts to our tissue quality and our tissue health. So optimizing those things by quitting smoking and managing our weight can really help with how our body copes with that stress of labor. Getting on top of constipation. So if we think about having a stool backed up in our rectum, that's going to increase that pressure in our abdomen, which can increase that risk of tear injury in labor. So making sure you eat plenty of fiber, taking on plenty of fluids and getting moving can be really helpful to manage that. From 35 weeks, you can introduce perineal massage. There's lots of guides for this online. It's very easy to do. And it might be that if you can't do it lying down because of your bump, you might just step a foot onto a chair and do it in standing. So slowing down deliveries, this is where our midwifery team can help. So as part of the OASI Care Bundle, which is a bundle of care that's supposed to reduce risks of obstetric tearing, your midwife can support your birth to help reduce the risk of tears. How they do this is by supporting the perineum as the baby comes out of the birth canal for a slow and guided birth. When you've given birth, you enter the 4th trimester, and this is a recovery period and a period of adjustment to a new baby. Rest when you need it, eat well, again, plenty of protein. We're looking for that rainbow plate and lots of snacks throughout the day. Stay hydrated, particularly if you're breastfeeding, you might need an increased amount of fluids during that time. Remember that you are healing. Allow your body time to recover. Starting soft with gentle movement like short walks, breath work, pelvic floor exercises, and stretching can all be a good place to introduce movement back in. Again, after a couple of weeks, we can bring in more structured exercise, so body weight exercises. We'll discuss this a bit more in the next slide. As you progress on, longer sessions, returning to the gym might be more appropriate around 6 to 8 weeks postnatal. Consider your feeding postures, whether you're bottle or breastfeeding, to help support your body, thinking about sitting upright, maybe changing the position of the baby, or using breastfeeding support pillows to help with that position. Remembering to ask for support when you need it. So if someone else can carry the baby, if you're experiencing back pain, or if there's anything anyone can do to help you get about your day, definitely ask. This might be another area you stop and you take a screenshot of. This is a bit of a guidance for return to exercise. Now, this won't apply in the same way to every person. We're all quite different. So someone who maybe is quite sedentary, doesn't exercise a lot, might not find themselves ready for things like bridging and squatting at 2 weeks postpartum. And conversely, someone who's very active might find this all quite easy. But we do recommend that gradual approach to exercise. So we're slowly building up our tolerance postnatal. We're starting with our pelvic floor, our gentle stretches, our pelvic tilts and walking, moving up to body weight exercises, things that are low intensity, quite static movements before maybe taking on something like static bike or a cross trainer for that higher intensity, and then gently progressing to faster walking, cycling, lifting heavier weights. And as we progress on, we might get back to running or get back to our usual sports. That brings us to the end of our session. We also offer some postnatal exercise classes, and you can bring your baby along to those. You can keep this code, again, take a screenshot if you need, and scan that code once your baby has arrived, and we can get you booked in for classes from 6 weeks for a vaginal delivery and 8 weeks from a C-section.